imagine a younger version of me, a much cuter version of me. So I was, think, 14, 15 years old, and I had to wake up very early. I had to get to the hospital at 6 a.m. So a little about myself, I have no problem staying up very late, right? So if you want me to stay up till 8 a.m. the next day, not a problem. But to wake up early is always a challenge. But I needed to wake up early because I needed to see a specialist. And the assumption is that if I wake up early, I get to see the specialist. The reality was that I didn't get to see the specialist until sometime 1 p.m. So imagine getting to the hospital 6 a.m. and only seeing the specialist at 1 p.m. Several hours wasted. I threw a tantrum at the hospital. So that led me down the journey of thinking, how do we actually address this problem? Was it a one-off? No. I've seen instances over the years where mothers had to carry their lifeless babies in their hands because they brought their baby to the hospital. It was an emergency, but there were no specialists available. They were all busy, or there were no beds available. And so that was the end of it. So imagine those experiences. And so one easy thing to assume is that it's the people working in the hospital, they are the problem. I'm sure you all heard the incident that a gentleman that slapped a nurse in one of the hospitals. This happened just a few weeks ago because they brought in their grandmother and their grandmother was not being attended to. But the honest truth is that it's not the people working at the hospital that the issue is, that they are overworked. There are too many of us and not enough clinicians. And as someone who believes in the idea of solving problem with technology, the question was, how do we make this happen? So when we started, my first assumption was that we need to book appointments, right? So if you just build a system that books appointment, it solves the problem. Then I realized that that was not enough, and I had built a system that was over-engineered, and so then we had to revise it and simplify it. Eventually, we ended up with a system that is called Moremi. What we intended to do with this project was to have AI help support medical doctors. But not just medical doctors, just broadly medical professionals. So because they are nurses and other people who work within the hospital. So we looked at how do we have the AI system support several imaging modalities. We ended up supporting over 30 imaging modalities. So everything from X-ray, mammograms, and the list goes on. And then the AI system can do this in just seconds. The wish list was, imagine you could have an AI system that does several things within the hospital. How many people here are familiar with the term AGI? Put up your hand if you are. Okay, a few. How about AI? Okay, exactly. So we all know AI, artificial intelligence. Artificial general intelligence, AGI, stands for the dream of having a single technology that can match human performance across several domains and several tasks. That's what the dream is. And the question that we were interested in was, what if you could do this in healthcare? What would be the implication of this? So we wanted a system that we could just combine a whole lot of medical data collected from different parts of the world, feed it to the system and see what we'll be capable of. So we fed the data across some of these areas and even much more. Then we also did in biology, because one of the challenges is that we do not have effective drugs for the many diseases that we have in the world. So what if we could have AI systems that will help us design drugs? We fed it with this data. The amazing thing is that we essentially made a scientific breakthrough because we were able to pull it off. After feeding the AI system all this data, we ended up with something that could perform several tasks in healthcare and biology, and we've already are using it to design new drugs for malaria, hepatitis, cancers, and things like that. Some of the key things we wanted the AI system to do was to be able to write medical reports if you give it an image. And so it does exactly that. What you're seeing here is the AI system given an x-ray, and then it drafts a medical report before the radiologist comes in to review it. So with all the nuances that is required in healthcare, the AI system is able to do that. The next one is with a mammogram. The AI system is able to pick up calcification, masses, and then even do the categorization. The implication of this is, it's one thing to buy a medical device and let's say an NGO donates a medical device to one of the small towns around Brekusu. The question is that if that image captures a mammogram, who would interpret it to let an 80-year-old woman know whether she has stage 1 cancer, right? Because the difference between life and death for certain diseases like cancer is how quickly you detect it. And so the challenge is we don't have enough people globally, but even more so in our country, we only have 100 radiologists. But the opportunity here is that AI presents us with the opportunity or presents us with the chance to have an automated way to detect some cancers very early on. The other thing was making sure the AI system could support prescription, knowing what is the right recommendation for certain medications to take. And we ended up doing exactly that too as well. So in this case, assuming that the guideline, the WHO guideline for a certain disease is for you to take Curastel. But then realistically in that town as it stands right now, you do not have Curastel. You could ask the AI system what are the substitute for Curastel and to tell you Telvilite, Telozite. And so that gives you the opportunity to still save lives even if you don't have the ideal drugs present. Another complex thing is matters relating to the heart. And I don't mean emotional feelings and, when you chop breakfast, if you know what I mean, but your actual physical heart, right? Unfortunately, one of the leading causes of death in Ghana is cardiovascular diseases because we don't spend enough time checking our heart condition and the state of our heart. And the danger in there is that when it comes to cardiovascular diseases like heart disease or heart attack or hypertension, what happens is that you don't sense anything. If you have a headache, you wake up and you have a headache, you feel it. So you know that, okay, I need to go see, a clinician or a pharmacist to ask what is happening. You could have hypertension your whole life, you wouldn't know. Everything will be going normally until the moment where your heart can't handle it anymore and you fall down and you're gone. I'm not trying to scare you. Actually, that's a lie. I'm trying to scare you. Trying to scare you to care more about your health. So as you're young, you need to spend more time checking your heart health. And one of the limiting factors is access to people who can read this ECG readings. So the ECG captures your heart's rhythm and all of that, and you need someone to be able to interpret it. So we made sure that the AI system can also interpret this. We went further to do a lot of things. So cytology, being able to detect things like cervical cancer, we did that with the AI system, and also genomics. So how do we look at your genomic data to not only say what is wrong with you today, but potentially predict what could be wrong with you down the line. So if you have certain variants in your genome or genomic sequence, we could tell that you have a high chance of developing certain cancers. So certain mutations make you prone to developing certain diseases or developing certain heart conditions. So being able to get your profile, passing all that data, transform it, now we are looking at preventive healthcare. And so the AI system can do all of that and then also come up with measures and considerations for you, recommendations that are personalized specifically to you. So personalized healthcare. And then we do a lot of things in breast cancer. So earlier we mentioned mammograms, but we can also do it via lab readings that are collected in the process of biopsy. So that's when they take sample tissue and then examine it within the lab. And so some of the things you can do is look at risk profile. So predicting things before they happen. Then also, like I mentioned in drug discovery, we are able to do a lot of things within drug discovery. The challenge in drug discovery right now is that before you get your paracetamol or any drug that you buy at the pharmacy, it can take up to 12 years and cost $4 billion, right? It's a very expensive and long process. So the question is, how do we leverage AI to cut down the time and the cost involved in it? How many people here have heard of AlphaFold? Okay, at least one person. So the Nobel Prize in chemistry was essentially given to an AI last year, or was it just a few months ago? So it wasn't given to an AI, it was given to the people who built the AI for, but realistically, it was supposed to be given to the AI because the AI system solved something called 3D protein folding, right? And this was a major breakthrough when it comes to being able to design drugs. But that's just a tiny thing along the lines of what AI can do in drug discovery. So we've been working with researchers all over the world to push the barrier, push the very edge of what you can do with AI in drug discovery. And so some of the things we've been able to do is use AI to now work towards creating new vaccines, drugs, or in this case specifically, they are called antibodies, and then even new forms of diagnostic testing for malaria, which still kills a lot of people, unfortunately, children. So the spaghetti looking thing that you are seeing on the screen, that is what on the left is basically a potential new drug that we are working on. And then on the right is the drug, how it connects with the malaria parasite that we are working on. And also another thing is that the reason why it takes up to 12 years is you develop something, you take it to the lab, and then you now need to go do mice tests, then you now put it in humans and all of that. If you can have the AI system predict the likelihood of the drug making it through all that pipeline, it helps you. So that's one of the things that we did, making sure that we could have AI somehow predict the success of it. In 2022, we conducted a research where we collected data from Ghana, Vietnam, and the US, and we worked with radiologists in Ghana that had up to 20 years experience. And we realized that the AI system actually outperformed individual radiologists, right? The AI system is not meant to replace, it's here to support radiologists, doctors, and essentially most feel that's what it's meant to do. However, making sure that the AI system is extremely good at some task, even superhuman performance is essential. And if you're working in healthcare, safety matters to a lot. So you need to test the AI system. So that's exactly what we did, and we put out a paper in that direction. Since then, we've been able to scale the project across the globe. We have usage in over 50 countries, and we've processed, we call it tokens. That's the amount of data we've been able to process and generate over 80 million tokens so far. So everywhere from Ghana, US, India, Pakistan, Nigeria, and several parts of the world. So if you look at the state of healthcare, in Africa, you will see ratios where one doctor has to take care of 7,000 people, all the way to one doctor has to take care of 60,000 people. I don't know the population of Ashesi, but if that math, we go by that math, what's the population of Ashesi? So I had some number here. What number? Oh, that's small. So basically, like, you need 60 Ashesis and all of you can only see one doctor. So if you all see different doctor, you are cheating, right? That's how bad healthcare is. But the opportunity here is that if we let AI systems augment and support the existing labor force that we have in healthcare, we can make healthcare accessible, not just to the haves, but to everyone. So the question that I'll leave you with is, you now know what AGI means. How do we ensure that as we are building towards this technology that is superhuman, can do several things that humans do? how do we make sure that it extends healthcare and makes it accessible to everyone on the planet, no one left behind? How do we build systems as we are focused on their accuracy? How do we ensure trust, fairness, transparency within AI as you'll be using it in healthcare? And are we truly ready to co-create this future that is built on AI, ensuring that we all have access to good healthcare? For us, we've not been able to do this by ourselves. We had to work with several people. And I'm sure some of you here are interested in AI, and probably, I hope you take on the interest of working in AI specifically for healthcare. I think it's better than, when you use AI to essentially help students cheat on their homework and assignments, right? It's more fulfilling work to build AI STEM for healthcare. So a lot of partnership is required to pull that off. And for us, we've had to work with several people around the world. And I invite everyone to play their role in building this AI-driven healthcare future. Thank you.